Those last couple of presentations, well, all of the presentations have been fantastic, which I think is a great segue into the Stroke Foundation and our Stroke Connect program, which I want to talk to you about today, which I think some of you may be familiar with, some of you not, but it'll be a nice resources can underpin the work that you do. Education and support and their families and carers. So thanks for having me here today. Next slide, thanks, Barbie.
Sorry.
So just to put it in perspective for you, as we all know, stroke is a huge problem in our community. It kills more women than breast cancer and more men than prostate cancer. And I think there'll be around 5,000 strokes this year in WA, and around 30% of stroke survivors are of working age, which is why we need to really get the message of FAST out into the community, because we need people to be aware that stroke's not just something that happens to older people, it can happen to anyone at any time. Next slide, thanks, Barbie. So if we look at the impact of stroke in Australia, and I don't need to tell you what that's like, you all, many of you would be working with that, but we know that many stroke survivors will have significant unmet needs once they leave hospital. They're more likely to have relating to, personal and self-care, their movement and communication. And I think one of the most important ones is that they're likely to experience depression. We say it's around 2/3, but we know through our interactions with stroke survivors and what their carers report to us that anxiety and depression is a huge problem. I think we can all understand when you suddenly have this life-changing event that happens so quickly to you. We all are aware that, there's going to be a lot of anxiety and fear about another stroke, and also, depression about the changes that have happened to their life and how they're going to move forward. And if I can also stress to you that one of the things that we have found through our audits is that mood assessment is done at a very low level. So if I can draw your attention to that, it's something that we really need to do a lot more about, to ensure that we give people information, recognise that as a need, and that we give people information of how they're going to connect with that providers once they get out into the community. And also we know that stroke impacts not only the stroke survivor, but it does also impact their carer and their family and friends. Next slide, thanks, Barbie. So if we look at what are some of the barriers to support, and some of the presentations have really touched on that today. People, once they get home, they describe going into a black hole, and there's a poor understanding of what's available out there in the community. As we all know, it can be very challenging for people to navigate their way through not only the health system, but also the community and social services that are out there. It is really, really tricky for people to identify and understand how to access it. It's really, really complex, and we hear lots of talk about that when we look at things like the NDIS for people under the age of 65, and then also for people in the aged care system as well. Those supports and accessing those can be really complicated, and often lots of timelines and delays in being able to get access to things. We also know that people have difficulty with access, and the last two presentations from Ruth and Tony have really highlighted where telehealth can come. It can really help that, because cost is a huge pressure on people, transport, parking, being able to have access to transport, and then there's the availability of resources, and financial viability we find is a huge issue for people being able to things. So that can be really such a barrier to people to getting support. And this, of course, all of those sort of things that we're talking about, including mental health challenges, just completely overwhelms people in their recovery, and there is a real sense of hopelessness, which we often talk to stroke survivors about. And then there's the limited connection with peers who understand stroke. So people often feel quite isolated because they feel that their family and friends don't necessarily understand what is going on for them. And this is a perception that many stroke survivors have, is that their needs are not legitimate and they don't seek support. And I think this is particularly so when people have some cognitive impairment and they just describe it as, I just don't feel the same as I used to feel, but I can't describe it and no one really understands how I'm feeling. Next slide, thanks, Barbie. So we have a program at the Stroke Foundation which is Stroke Connect. It's kind of like a suite of programs which I'll tell you about and resources. It's delivered by health professionals and it provides information, it's advice, it's support and referral, and there's many ways that. One of the immediate ways is the My Stroke Journey, the pack and the booklet that I'll talk about further in a moment, but that's one important way for people, first and foremost, to get information, to know that the Stroke Foundation exists and to know what resources and services are available to them. We also have Enable Me, which is our online platform for consumers and carers and the community to use and to access and find connection. We also have Stroke Connections newsletter that we send out to stroke survivors and family members, and that's great for people that are not online and has great stories and information in there for people. And then we have Stroke Line, which is manned by health professionals and is available Monday to Friday for people to access. Next slide, thanks. Next slide, thanks, Barbie. Oh, sorry. Okay, so we're looking at now the My Stroke Journey Pack, which most of you would have seen and hopefully you are using. Unfortunately, the data sort of tells us that it's not used enough. It's only just over 50% of people we think are getting this information, so we really need to be mindful of that. And please talk to me after this presentation or make contact with me because I'm very happy to help expedite and get that to you as quickly as we can, boxes of these resources. The My Stroke Journey Pack is an education and discharge planning resource. It will help you deliver on the high quality stroke education that patients and family members and carers need to be able to equip them to fully participate in their care. It's patient-centred. It encompasses some care planning to support goal setting and will also help you in your transition from hospital to home. So it will help you with your discharge planning for your patients. And in formulating the My Stroke Journey Pack, we did extensive consumer consultation, and there may have been some health professionals out there that are also may have been involved in some of the permutations and consultation that has taken place over many years. Next slide, thanks, Barbie. So we have two versions of the My Stroke Journey. We have the Easy English version, which we developed a couple of years ago, and we have the classic version. These two versions are summarised there. You can see one is the sort of the bluey purpley one. It's the Easy English, and then we have the other one, which is the My Stroke Journey, the classic, as we call it. The idea being here that the Easy English one has got a lot more pictures in it and less words, and is designed for easier reading of the information. And in fact, some health professionals are preferring this over the classic version. It's really up to you, but it may well be useful for some of your patients. Next slide. Okay, so there's classic versus easy English. As you can see there's the classic on one side and the easy English. Comparatively, you can see there is less words, a little bit more boldness in some of the colours and things like that. So that's just an example of what it looks like. Next slide, thanks, Barbie. So if we come back to the question, how do I use the My Stroke Journey with patients and carers? What we want you to do is provide the My Stroke Journey Pack to the patient, their family member or carer in the first few days after admission. Now, my understanding is that most of you on here today will be in the rehab space, so it's worth asking patients and family members whether they did receive something in the acute space. Some hospitals are giving it out quite well and give it immediately, and some are not. So it's worth asking because they may well have it, and if they have it at home, the family has it at home, the carer may be able to bring it back in. But you may also find that some patients, especially if they're not on a stroke unit and they're an outlier in another part of the hospital, they may not have received the information. But we do believe that people need to have the information as soon after the stroke, especially for the carer and family members, to kind of get their head around what's happening, and the more information they have is really helpful. In addition to that, you can add in our relevant fact sheets, which you may all be aware. We've had fact sheets, you know, for a range of things like driving after stroke, fatigue, all sorts of information in those fact sheets, and the idea being that you pick the relevant fact sheets and you customise the pack for the patient. Also in the booklet is included the care plan sections, which if you do that, that will help you comply with all of your good standards of care that we're meant to be delivering to patients. So we've provided all that there for you. Also, let patients and families know about what supports and services they can access after they leave hospital. There's places in there for you to document that for the patient, and make sure that you document in the patient records that the My Stroke Journey has been provided and that the care plan sections have been completed. Next slide, thanks, Barbie.
5 minutes, Jonine.
Okay. So here in the blue sections in the booklet, you'll find these are the completing the care plan sections. The sections are highlighted in blue throughout the booklet. Fill out the care plan in the sections in partnership with your patient. Partnership is really important. The patient needs to be part of this process. And different team members may also be involved in completing the care plan section. Next slide. Here's just a pictorial there to show you in the booklet. It's really important to talk to your patient about the stroke and what has actually happened to them. And there's a tick on there which says don't forget to talk about cause in terms of risk factors. Next slide. Meet the stroke team. This is an opportunity there in the booklet for you to insert the name and contact details of each stroke team member, and have each team member do this routinely on the patient admission. Next slide. Secondary prevention is covered in the booklet as well. Use the checklist to tick your patient's risk factors and write notes as needed. And there's a tip there also about utilising motivational interviewing techniques to gain an understanding of your patient's priorities for their lifestyle modification. And you can find this also, the resources for motivational interviewing are also on our Inform Me website, which I'll talk about in a moment. Next slide. There's the fact sheets for you, which I talked about, that can be customised and put into your My Stroke Journey Pack for your patient. There's a whole range of them there. A lot of them have been updated recently, and they're also online on our website. You can access those and print them off as well. Next slide. Don't forget, documenting use of My Stroke Journey. If it's not documented, it hasn't been done. So please make sure for auditing purposes that it is documented in there, and it's good practice. Next slide. What's available to help health professionals use My Stroke Journey? If you go to our Inform Me website, you'll see there we've got goal setting templates, we've got care plan downloads, we've got training modules, we have FAQs which cover all of the material contained in this presentation. We have chart sticker templates that you can use as well for the medical record to say that it's been given, and the motivational interviewing resources. Next slide. Inform Me website that I just spoke about. As you can see there, we have our stroke data. So your audit data results are in there. It's secured and locked down. Nobody else can see it, but you can use that for your team activities to go back and review your results and have a look, and that can help you with some of your quality improvement activities. The guidelines, the clinical guidelines are there, living guidelines now, which we're very proud of, and are being updated all the time, so you can access those there, and also the resources section in there. There's lots of resources in there as well for you, and you'll get newsletters from us as well, so please sign up for that. And Stroke Line is a free service that's available. It's an individualised service. Just remind your patients that they can access it, they can talk to an allied health professional. As I said, it's manned Monday to Friday, and but just remind patients that when they call, they may not speak to someone straight away. They'll be asked to leave a message and someone will call them back as soon as possible. But just be aware, especially at the moment, if people are going to be discharged a bit earlier and you're concerned, for all patients, make sure they're aware of Stroke Line. It's on the back, the details are on the back of the My Stroke Journey booklet. Draw their attention to that and make sure they get that information, and we're very happy to help people. Next slide. Enable Me also. This allows people to connect with community. It's information, it's connection, it's a whole range of tools. People can set and track their recovery goals. You can use this as part of your work that you're doing with your patients. You can tap into Enable Me, show them all the information there, and you can use the goal setting sections of that. And this is really good if you can show people this on an iPad or connect to them, get them to connect to it while they're in hospital, and family members be aware of it. Especially our younger stroke patients really, really do enjoy using Enable Me, and they really do love connecting with people. We put lots of videos, we put podcasts on there. There's a whole range of information that goes in there very regularly. And also, as health professionals, jump on there as well and use it. And a lot of health professionals participate in chats and connection to people as well. It's really worthwhile. Next slide. Okay, so there's my email address there. If what I've presented today, if you think that would be useful to any members of your team, very happy to run through it with your team members. But I think one of the things that I really want to stress is if, you know, at this period of time, at this juncture, if you feel that people are going to need a lot more support, please reach out to us in Stroke Line. We're also, as an organisation, kind of thinking a little bit more outside of the box of how we might be able to provide greater support to stroke survivors and families. So I will keep you posted with that. But thank you very much for having me.